Welcome to It's Your Case, presented by VetCity.com. I'm Virginie Barberet, your radiologist on demand for this week. Today's example is a 5-year-old female neutered crossbreed dog with acute onset of left hind lameness. Once you have reviewed the radiographs using your systematic approach, then you're ready to watch this video. Now, I will highlight the most important findings for the stifle in this case. When we assess stifles on radiographs, the first thing we are looking for is the presence of joint diffusion. So how do we assess this? Well, we first look at this infrapatellar fat pad, which is this radiolucent triangle of fat at the cranial aspect of the joint, and we assess if it's displaced cranially, pushed cranially by soft tissue opacity at the level of the joint space, which is the case here. So you can see all this soft tissue opacity pushing the fat pad. Normally the fat pad would extend a bit further caudally into the joint there, well, on the surface of the joint there. We can also assess the caudal fascial planes. They appear as a radiolucent line here at the caudal aspect of the stifle and the proximal tibia because of, again, of the presence of fat in that region. So you can see that those caudal fascial planes are a bit displaced caudally. Normally they would follow a bit more closely the bone by this soft tissue opacity, again at the level of the joint space. On the craniocaudal projection, we can also assess if there is widening of the medial aspect of the joint space, which is also a sign of joint diffusion. The second main finding on this radiograph is the presence of degenerative joint disease, which appears as presence of new bone formation, smooth new bone formation on different margins of the joint. So you can see here, for example, on the distal femur, proximal tibia, distal patella, proximal patella, and on the fabellae as well, like here and here on the craniocaudal projection. And we can also see some new bone production on the tibial plateau at the site of attachment of the cranial cruciate ligament. So this would indicate the presence of mild to moderate degenerative joint disease. And then finally, what we can also assess is that the tibial eminences here are slightly displaced cranially in relation to the mid aspect of the femoral condyles. They would expect to be a bit more positioned something over there, and here it's a bit more cranial than expected. So all those signs combined, so we have joint diffusion, we have degenerative joint disease. So all those signs are quite commonly seen with cranial cruciate ligament rupture or injuries, especially the cranial displacement of the tibia in relation to the femur would be quite indicative of this. Otherwise, without this cranial displacement of the tibia, any other cause of joint diffusion and osteoarthrosis could be considered. And for joint diffusion, we could include arthritis, whether it's inflammatory or immune-mediated, for example, or any other soft tissue injuries could also be the cause of this. But the most common being the cranial cruciate rupture. That's what we would consider first in that case. So that's it for today. Be sure to review the full report associated with this case. Thanks for listening, and remember, it's your case, so please post your question on social media.